My name is Carolina Castillo, and I'm going to be focusing on the underserved population in Miami, Florida. Miami, Florida is a large melting pot, and the majority are Hispanic or Latino. There's about 65% Hispanic or Latino resident in Miami-Dade County, and about 19% of African Americans. Miami-Dade County has a large minority population, and a large chunk of that are Latinos and African Americans. Miami-Dade County has some of the highest rates of uninsured populations in America, with almost 40% of population uninsured. Baptist Hospital has gathered a significant amount of research regarding the underserved population in Miami. They came across the fact that over 50% of the population in Miami's service area live at or below the 200% of federal poverty level. 25% are under 21 years old, 59% are in the ages of 21 to 64, and 16% are at the ages of 65 and over. Baptist Hospital has 6 main healthcare priorities, which are access to care, availability of primary and preventative care, barriers to accessing care, chronic disease management, mental health and substance abuse, and socioeconomic challenges, and this will be discussed further in detail along the video. When focusing on access to care, many people cannot afford insurance or are not offered it by their employers, which reduces their access to care. Of Miami-Dade's residents, 34.4% under the age of 65 do not have health insurance, and this is stated from the Center of Disease Control Community Health Status Indicators. When it comes to availability of primary and preventative care, the nationwide shortage of primary care providers is expected to get worse as the population ages and as fewer medical students choose to practice primary care due to low rates of reimbursement. Homestead was deemed a health professional shortage area as a designated by the Health Resources and Service Administration. Now coming to the topic of barriers to accessing care. These barriers include lack of availability, high costs, and lack of insurance coverage. These barriers to accessing health services diminish quality of care and lead to delays in receiving appropriate care. Compared to the other national markets of a similar size, of 17.1% of adults did not see a physician due to a barrier. That's higher than the national median, which is 15.6%. Chronic disease can be prevented and often controlled but rarely cured. The Miami area often struggles with high hospitalization rates for heart failure. The number 1 cause of death in the county is heart disease. For those who do not know, diabetes is also considered to be a chronic disease. In Miami-Dade County, 8.1% of adults reported a diabetes diagnosis, while the statewide county average is 11.2%. When it comes to mental disorders, in 2013, 23.1% of adults are living with Alzheimer's disease and dementia in the Miami-Dade County. That is twice the national median of 10.3%. The last main priority is socioeconomic. One's level of education, employment, and income closely links to one's health. Low-income and minority neighborhoods are less likely to have access to healthcare facilities. Miami-Dade County has 20.8% of people living in poverty, when the U.S. median is 16.3%. In conclusion, the Miami community, specifically Homestead, had the most pressing healthcare needs of access to care, availability of primary and preventative care, barriers of accessing care, chronic disease management, mental health, and socioeconomic challenges. This leads a community to be vulnerable. Data from the American Communities Survey shows that 26% of Blacks and African Americans live below the federal poverty level, followed by 17% of Hispanics and 10% of non-Hispanic whites. Nearly 34% of residents are uninsured. Miami-Dade must strive to promote awareness and access to preventative health services to break down the barriers to care and improve the health of all the residents. With all being said, I leave you all with 2 questions. First,
What can be further done to engage underserved communities to increase access to healthcare and improve outcomes? Second, what were the main factors that made Miami, Florida to be in the state of vulnerability?